Hello, I'm Dr. Marla Shapiro. I'm professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees of the North American Menopause Society. Today, we are joined by Dr. Cheryl Kingsburg, who is the Chief of Behavioral Medicine at McDonald's Women's Hospital and Professor in Reproductive Biology and Psychiatry at Case Western Reserve. So from the patient's perspective, if she's suffering from loss of interest in sex and this is distressing her, and has a physician who's not asking that at any time in their appointment, what can she do?
Well, the simple answer is she should find another healthcare professional.
But it's often hard to do and often has a good relationship with the healthcare professional,
Absolutely.
but it's sort of don't ask, don't tell.
Unfortunately, it is. Everybody is a little bit embarrassed, even your own doctor, about talking about sex. They don't want to embarrass you, they don't want to make assumptions, and everybody's a little bit uncomfortable. So although ideally your healthcare professional should be asking you, if they don't, and you like them, it is always okay for you to bring it up, to say, and try not to wait till the last 2 minutes of the office visit when their hand is on the door.
That's good advice.
But to say, you know, I'm really having some questions and some concerns about my sexual health. I would like to talk to you about that. That should open the door because it's a very simple assessment to figure out what's going on. There are typically 4 areas of problems. There's either loss of desire, difficulty with arousal, orgasm, or sexual pain. Those are 4 distinct things that any healthcare professional can easily assess, and really to make a diagnosis as to whether they would recommend treatment is whether or not you're distressed by it, because nobody's going to sort of force you to address something that really isn't a concern for you. But we certainly know that sexual health is important to quality of life and overall health, and so we don't want to ignore it. So even if they're not opening the door, you do it.
So often as a patient is made to feel that this is just a normal part of aging, that go on a date, find some time to be alone. This is a function of mortgage, lifestyle, and so on. Is that true?
It isn't true, and we've come a long way in educating even our healthcare professionals to recognize that sexual desire is actually all in your head because it is both psychological and neurochemical in terms of problems. We know that there are physiologic factors, just like with depression. 30 years ago, we used to think of depression as all in your head, and now healthcare professionals are well aware that there is neurochemistry and an imbalance there that can impact mood, and we have antidepressants along with psychotherapy that can help. And the idea of pick yourself up by the bootstraps or go on a tropical vacation, whether it's for depression or sexual problems, is not sufficient as an answer. We have treatment options now.
So the one message you have for women as patients?
Be your own advocate. Do not suffer in silence. If your doctor doesn't bring it up, you bring it up because sexual health is too important. Women want a good sexual life. Go get it.
Thank you so much.